Hello everyone, myself Dr. Sahil Patel, a consultant homeopath. So today we are going to talk about a topic from physiology, actually applied physiology, which is dehydration. So the summer season is ongoing and we all know the condition that human physiology develops. Not only animals, birds and all the living organisms undergo this physiological process, which is a natural process. So let us start with dehydration. As we define, dehydration is defined as excessive loss of water from the body, which may be that the body requires all those fluid intakes and all those things for maintaining the normal functions of our body, which is about 1 liter is a daily requirement. It may vary on the basis of age as well as the physical activity of the individual, and the most active individuals need 2 to 3 liters of water intake daily. Dehydration occurs when fluid loss is more than what is consumed, right? So let's go for the classification. Classification is based on two types. First one is of the dehydration is of three types. First is mild dehydration. It occurs when fluid loss is about 5% of total body fluids. Dehydration is not very serious and it can be treated by rehydration by taking oral intake. Second one is moderate dehydration, in which it occurs when fluid loss is about 10%. Dehydration becomes little serious and immediate treatment should be given for this type of patients. Third one is severe dehydration. It occurs when fluid loss is about 15%. Dehydration becomes severe. It may require, not may, but it actually requires hospitalization and emergency treatment. And if 15% and more fluid loss is present, then dehydration will become a very severe and life threatening also. So this was the first type of classification. Now let us talk about the medical classification, which is based upon water loss as well as sodium loss. So there are three types for its classification. First one is isotonic dehydration, balanced loss of water and sodium, as in the case of diarrhea or vomiting is there. This is isotonic. Next one is hypertonic dehydration, in which loss of more water than the sodium is seen. It is especially seen in the cases of fever which are persistent. And third one is hypotonic dehydration, in which sodium loss is more and water loss is not much more, which is seen in the cases of diuretic uses or AKI patients and such. The next is causes of it. Causes of dehydration are that severe diarrhea and vomiting, which is because of GI tract disorders or infections. Second cause is excessive urinary output due to renal disorders present, persisting CKD. Third reason is excess loss of water through urine due to endocrinal disorders, especially seen in diabetes mellitus, diabetes insipidus, as well as adrenal gland insufficiency also causes dehydration due to excessive loss of water through urine from the body. Fourth reason is insufficient intake of water. Fifth is prolonged physical activity without consuming adequate amount of water in hot environment. So basically the time which I am posting this video is a summer condition, and in which people who are constantly going for physical activities like gym, jogging, running and all those, they should be aware about their own water intake because it is much necessary. The next sixth reason is excess sweating, which may lead to heat frustration, which is extreme loss of water, heat and energy from the body. So severe sweating and dehydration occurs while spending longer periods on regular basis in the saunas. So this is seen in sauna. And the last reason is cause is use of laxative or diuretics in order to lose weight quickly. This is most commonly seen in athletes because what they do is that if they are going for any final performance or final play of their athleticism or their games, so they use diuretics or laxatives so that their weight will be losing. So these are the common causes of it. Then let's talk about sign and symptoms. So for sign and symptoms, I have divided it into three types. First one is mild and moderate dehydration, in which what happens is that dryness of mouth, excess thirst, decrease in sweating, decrease in urine formation, headache, dizziness, weakness, cramps in legs and arms. These are the symptoms of mild and moderate dehydration. Next one is severe dehydration. In severe dehydration, decrease in blood volume is there, cardiac output is decreased, low blood pressure, fainting is seen in the patient, hypovolumic cardiac shock may be present in cases of severe dehydration. And the third type is very severe dehydration. The symptoms are damage of organs like brain, liver, and kidneys. Kidneys are much more affected, firstly. Then, second is the mental depression and confusion in the cases of very severe dehydration. Then, renal failure, convulsions, even coma like condition may develop in the cases of very severe dehydration. Now let us talk about for the infants. What happens in infants is that infants suffering from severe diarrhea and vomiting caused by any viral or bacterial infection may develop dehydration. It becomes a life threatening if the lost body fluids are not replaced. So this happens when parents are unable to recognize the signs for an infant. So emergency care to be done for infants. Next is aging effects on dehydration. And for elders, there are higher risk for dehydration even if they are healthy. It is because increased fluid loss and decreased fluid intake. Most likely, severe dehydration is seen in old age and it may be fatal for our patient. So let us talk about treatment. This is a normal phenomenon of our body. So treatment depends upon the severity of it, right? For mild dehydration, oral drinking of water is best. Stopping fluid loss is the best option. Means laxatives or diuretics should be stopped for this patient. In cases of severe dehydration, drinking water alone is not effective. So for compensating the salt loss, the effective treatment for it will be oral rehydration therapy. Oral rehydration therapy, let me define it. ORT is a treatment for dehydration which is given by oral rehydration solution, ORS, which is formulated by World Health Organization. So this solution contains anhydrous glucose, sodium chloride, potassium chloride, and trisodium citrate. So in the cases of severe dehydration, proper treatment will be ORS, and if much more severe, very severe dehydration is present for our patient, then intravenous administration of necessary water and electrolytes is to be done. So this was the topic of applied physiology basically, and the topic's name is dehydration. If you like this content, kindly share it with your friends, and if you want to discuss if any on another any topics, then kindly comment down. Thank you.